Hi, this is Dr. Martorell. The topic will be influenza or the flu. Influenza is a viral infection that can cause fever, cough, body aches, and other symptoms. The most common type is seasonal influenza. There are different forms of influenza, such as type A and type B. The medical term for the flu is influenza. Besides the seasonal flu, other types of flu include swine and the bird flu or avian flu. All forms of influenza can cause a high fever, which is a temperature of 37.8 or 100 degrees, extreme tiredness, headache and body aches, cough, sore throat, and runny nose. The symptoms can start suddenly. Influenza can be dangerous. Most people get better on their own without any lasting problems, but some people will need to be hospitalized and some people can die. Influenza can cause complications such as pneumonia, for example. People that may be at higher risk for influenza complications include people 65 or older, young children under 5 years old, and especially under 2 years old, pregnant people, and people with certain medical conditions such as asthma, pulmonary disease, HIV, cancer, transplant, diabetes, and others. It is important to discuss with the doctor whether treatment is needed. Most people will not need treatment. However, some people will need treatment. Sometimes family members may also need prevention treatment to prevent from getting it. There is a test for influenza. The test is not always needed, as sometimes the doctor is able to make the diagnosis based on symptoms. To protect yourself against influenza, you should wash your hands with soap and water, stay away from people who are sick, consider wearing a mask, avoid crowded places, make sure there is good ventilation. Also, get the influenza vaccine every year. Some years, the flu vaccine is more effective than others. A lot of it will depend on the strain that is causing influenza versus the strains included in the vaccine. Even in years where the influenza vaccine is less effective, it will still help prevent cases of influenza, and it can also help prevent people from getting severely ill, getting hospitalized, die, and develop complications. Most people with the flu get better within 5 days or 1 to 2 weeks. People could take acetaminophen. It is important to avoid aspirin or aspirin-containing products in people that are younger than 18 years old. Always discuss treatment with your provider. Some people may benefit from antiviral treatments. Some examples include Tamiflu, among others. Antibiotics do not work for influenza. Antibiotics may be needed to treat bacterial complications from influenza, such as bacterial pneumonia, sinusitis, ear infections, among others. I hope this topic was helpful. Please join my social media. Thank you.